We're going to stay with the theme of calcite diagnostic aids with our next speaker who is Edouard Timsit, who's originally from France and now is at University of Calgary in Canada, and he's going to talk to us on the evaluation of a computer-aided lung auscultation system for diagnosis of BRD in feedlot cattle.
Edouard. Thank you, Mr. Chairman. So first of all, I would like to thank the scientific committee for inviting me here today to present my research on the evaluation of a computer-aided lung auscultation system for the diagnosis of bovine respiratory disease, or BRD, in feedlot cattle. Okay. So diagnosis of bovine respiratory disease, or BRD, in feedlot cattle is based on clinical illness using a two-step approach. First, cattle with visual BRD signs are detected by the pen checker. So those signs are depression, appetite loss, of respiratory characteristic changes. Then, identified cattle are moved to a chute for rectal temperature measurement. And a diagnosis of BRD is typically established when the animal has a rectal temperature above a threshold of 39.5 to 40.6 and visual signs of BRD. But do you think that this method of diagnosis is accurate? Unfortunately, it's not the case. By comparing lung lesion at slaughter, with the diagnosis of BRD based on clinical illness, the sensitivity and specificity was recently estimated at only 62% and 63% for clinical illness, which means that on average, 38% of the sick animals are not detected during the feeding period, and that 37% of the healthy animals or animals suffering from disease other than BRD are wrongly diagnosed with this condition. Several methods have been developed to improve the accuracy of BRD diagnosis in feedlots, including lung ultrasonography, lung radiography, measurement of serum haptoglobin concentration, and lung auscultation. Among these methods, lung auscultation is cost-effective, usually rapid to do, and also has recently proven to be able to accurately prognose first treatment response and case fatality rate. Unfortunately, as you all know, it also requires training, a good hearing capacity, and also is highly subjective. And I think Pat Pardon will talk about that more later today. To overcome those problems, I really have a problem with the pointer. Guys. To overcome those problems, a computer-aided lung auscultation system named Whisper has been developed. So the Whisper auscultation consists in holding the diaphragm of the stethoscope on the right side, on the left, in the fifth intercostal rib, 10 centimeters above the elbow, as illustrated here, and in recording lung sounds for 7 seconds. Then, lung sounds are automatically transmitted and wirelessly to a computer that is calculating a lung score from 1 to 5, 1 being normal, 5 being highly abnormal. And then, this score is sent back to the stethoscope. You'll see on this video that is actually pretty fast to perform. So here, he's placing the stethoscope at the right location. Then he's pushing a button to record. So we'll see that it will start to flash, meaning that it's the end of the recording, 7 seconds. Then the sound is automatically sent to a computer that should be within 3 to 5 meters. And the computer will display the sonogram and give you a score here to mild acute. So this system had the potential to significantly improve the accuracy of BRD diagnosis in feedlots. However, as Dr. Constable just mentioned, its accuracy needs to be evaluated by a third party. So this is why we did this study, to determine, in a case control study, the level of agreement between the Whisper and the veterinary auscultation, and also to determine the sensitivity and specificity of this Whisper to diagnose bovine respiratory disease in feedlot cattle. For this purpose, we followed 561 Angus horse steers during the first 50 days on feed. During the study period, the steers were evaluated clinically every day by pen checker, and each animal with visual signs of BRD were pulled. For each sick animal pulled, the pen checker also pulled an apparently healthy animal in the pen. Both sick and healthy animals were clinically examined by a veterinarian, and this clinical examination comprised rectal temperature measurement, veterinary lung auscultation, and the whisper auscultation. It is to note that we always perform the whisper auscultation after the veterinary auscultation to avoid any bias. The level of agreement between the stethoscope, the whisper stethoscope, and the veterinary auscultation were assessed by kappa statistics. A whisper 2 or higher was determined as positive, and a whisper 1 was determined as negative. The sensitivity and specificity of the whisper was evaluated using a Bayesian latent class model because of the absence of reference tests for ante-mortem diagnosis of BRD. For this analysis, the whisper was compared with pen checker classification using a two-test, one population model developed by Joseph in 1995. And this model assumed a conditional independence between the two tests because whisper and pen checker are based on different biological principles. Because we didn't have any prior information on the whisper, the priors for the whisper were uninformative, modeled with a beta 1,1. Concerning the priors for the pen checker, we have the sensitivity and specificity set up at 62 and 63% based on the study on Watt and Renter I presently produced in introduction. Priors for BRD prevalence were fairly uninformative, ranging from 30 to 70%, with a best guess at 50 because of our case study design. So let's move to the results now. 35 out of the 561 steers, so 6.2%, were detected with visual signs of BRD, and 35 were pulled as control. As you can see, rectal temperature differed significantly between the two groups, with a rectal temperature of 40.6 for the BRD case and a rectal temperature of 39.3 for the control. A whisper score was obtained for the 70 animals, with a score ranging from 1, which is normal, as I told you, to 5, which is highly abnormal. As you can see, 7 control had a score of 2, so was classified abnormal, and 6 BRD had a score of 1, so classified as normal by the tool. However, when we compared the whisper results with the veterinary auscultation, we found a substantial agreement with a kappa statistic of 0.77, which is quite high. And as you can see on this 2x2 table, only 62 out of the 70 were concordant. You can see here, with 36 that were positive by veterinary auscultation were also positive with the whisper, 26 that were negative by veterinary auscultation that were also negative by the whisper. The 8 discordant results were due to actually animals that were positive by veterinary auscultation but negative by the whisper. The Bayesian latent class model showed that actually the whisper had a good diagnostic accuracy with wide credible interval. The sensitivity was determined to be 93%, but with wide credible interval ranging from 71 to 99, and the specificity was 90%, ranging from 64 to 99%. Compared to the whisper, pen checker had a lower sensitivity and specificity, 63.5%. The higher specificity of the whisper compared to pen checker can enable to reduce significantly the number of cattle that are falsely diagnosed with BRD in feedlots, and therefore could promote a more rational use of antibiotic. Actually, if the whisper score is used in conjunction with animal previously identified as BRD case by the pen checker, we can increase the specificity of the test from 63% to 96%, which is a serial interpretation scheme with conditional independence. So a drastic increase in the specificity. Furthermore, data recently gathered by the manufacturer seems to indicate that high whisper score is actually associated with a higher mortality. If you look here, cattle with a whisper score of 1 will have, for example, a mortality rate of 9.7, whereas a cattle with a whisper score of 5 will have a mortality rate of 24%. Unfortunately, we didn't have enough power to investigate this investigation, and that should be our next step, actually, to confirm this association between whisper score and higher mortality or case fatality rate. But if you were there also on Monday afternoon, actually Dr. Lowe showed that there's still to be a very good association with higher score and higher mortality. So in summary of this short presentation, the whisper had actually a good diagnostic accuracy, albeit wide credible interval. That its use can significantly increase the number of cattle that are actually accurately diagnosed with BRD. And now further research should be conducted to investigate the association of whisper score and clinical outcome, and also determine how the stethoscope will change our way to manage BRD in feedlot cattle. So thank you very much for your attention. I would like to thank the University of Calgary for their financial support, as well as Feedlot Health Management Services for their technical support. And also, thanks some of my team members, like Dr. Afra Venermont, who was my master's student working on that project, Dr. Sebastian Buzinski, who did most of the latent Bayesian analysis, and he's here to answer your question if you want, and Dr. Booker also for his technical support. And this paper has recently been published in the Journal of Veterinary Internal Medicine and is in open access if you want to access this journal.
Thank you very much. Do we have any questions? Here's a question in the back. No? Yes, here's a question.
Oh.
Maybe a very simple one. Are you sure that the ones that were diagnosed by the veterinarian but not by the system were false positives, or do you think they might be false negatives in the diagnostic system?
Actually, that's a good question. No, we didn't take human auscultation as the gold standard. That's what we use the Bayesian latent class model, because actually we use pain checker as not as imperfect reference test in the Bayesian latent class analysis. So concerning the 8 positive results by auscultation but negative by the whisper, we don't know. It could be either false positive from human auscultation or false negative from the whisper, but nobody knows.
But that doesn't have an impact on your estimation of the accuracy of the auscultation system?
Not at all, no, because we didn't use human auscultation as a reference test. It was not part of the reference. Otherwise, that would have created bias, because lung auscultation is associated with the whisper. So if you use lung auscultation as a reference test, you will create a bias to evaluate the whisper.
Okay, thanks.
Do we have any other questions? I'd like to ask you one, and you don't have to answer this if you don't want to. But the lung score 1, 2, 3, 4, 5, I understand, but I think it gives you a word description: mild, acute, severe, acute, chronic. Is there any real correlation to the numerical lung score and chronicity?
So no, I guess here they made a mistake. I think it was a marketing mistake to put a chronic for the 5, because actually the whisper is not working very good on chronics. Tried it, so it's better on acute case. What I know, what I've seen is if you've got a score of, for example, 2 or 3 or higher than 3, you will have cattle that has an average daily gain that is very low, first of all. So really a difference in average daily gain already from some of the data that are non-published, and also a higher case fatality rate, but like double. That's what we observed also, but we didn't publish those data yet. So it seems that higher score is not necessarily associated with chronicity. I think that's a mistake, but it seems to be really associated with a higher chance of mortality.
Okay. Thank you very much. Thank you for the presentation.
Thank you.